Good evening. My name is Nargis Shirazi, and I'm a Women Deliver Young Leader. And I'm very happy to be here today. And with me are Pauline Irungu and Peter Benjamin. And they will be telling us about innovations for women and children. Pauline Irungu is the Senior Policy and Advocacy Officer at Path Kenya. And her Twitter handle is at Wairungu. And Dr. Peter Benjamin is the director of the mHealth Expert Learning Program. And he was telling me earlier on that he's wondering whether he still has the chance to surf at the age of 49. Our question. Tell the audience about one new thing that your organization is doing to improve women and children's health and how the rest of us can get involved.
Thank you very much, Nagis. Path is well known as a global innovator for health. And one of the things that we've observed as we've gone along over the last 40 years or a bit more is that just by developing good innovations in itself will not ensure that they change the lives of a woman or a child. And as part of our work, what we've learned is much more is needed. And that much more we figured is getting to advocate to get the innovations that are promising or that work into government policies so that we can commit governments to scale up these innovations so that they can be used around the world to change, especially the lives of women who are living in the poorest of places, can't access services, and don't even have the means to access those services. So our advocacy department has started to intensely advocate ahead of even getting the innovations out to any country or out of the testing processes with governments that such that they can start to prepare and start to think about how to bring those innovations to scale when they are ready. I'll give an example of what we're doing in Kenya. In Kenya, we're testing together with the Massachusetts General Hospital and a local organization called KIMET, the uterine balloon tamponade, a simple device made of a condom and a catheter and a syringe that helps in management of PPH in low resource settings. And the thing is, we do want to collect evidence so that the evidence can inform our advocacy for scale up. We've seen good results, and therefore we have some good data that we are using in our advocacy. A good opportunity presented itself for us in Kenya. And this is built on, among others, the INAP. As the INAP has been developed and is being finalized, Kenya started developing a maternal and newborn health scale-up plan for 3 years that runs between now and 2017. This presented a great opportunity for us as an organization with others to advocate for inclusion of the uterine balloon tamponade into the list of commodities, devices that are being listed in that scale-up plan, and to put in statements in that plan that demand that the government should procure, together with partners, the UBT once it's ready, and also train healthcare workers to be able to use the UBT. So that we are combining innovation and advocacy so that when the UBT, we have enough evidence, the plan is ready, it will be all systems go. And the government has bought into the idea, it's been written in, and therefore we will be pushing and ensuring that once we have the device ready, it can be scaled out to communities. We've also started doing some mapping to see the places that it will be most effective to roll out. Because it may not be everywhere and it may not be needed for every single woman, but it will work for certain places where access to healthcare is very challenging. So that's a sort of work that we're doing, knowing that we do need to combine innovation and policy advocacy so that we can drive scale up.
Okay, I'm interested to know how the UBT works, but before that, we'll get to hear from Peter.
Thank you very much, Nargis. I feel humbled to be part of this very impressive session with the extremely powerful testimony we've heard so far this evening. The work that I do is around how can we use mobile technologies such as the cell phones I see in half the audience that are tweeting away to support health. I absolutely understand that not everyone has access to it, and certainly not the high-end phones that are many in this room. But can we use the fact that literally a majority of people on this on our planet have a cell phone? Can we use that as a tool to improve health and healthcare, particularly around maternal and child health? My organisation called the mHealth Expert Learning Programme, mHELP, is trying to support people doing this work, build capacity to use these systems at scale. And thanks in particular to Johnson & Johnson for the support. There now are many examples around the world, more than just pilots, real evidence-based that this does work. Whether you're talking about probably the most famous of these projects, the MUMA, the Mobile Alliance for Maternal Action, that is supporting sending out messages, ages and stages, appropriately timed messages to around 1 million pregnant women and mothers of young children, with full-scale programs in Bangladesh and South Africa, starting new programs in Nigeria and India, working with over 300 organizations in 70 countries around the world. That's extraordinary in just a few years how that has grown. Young Africa Live, the Prekelp Foundation here in South Africa, over 1.9 million people use this social network, getting information around love, sex and relationships in the time of HIV, to use their phrase. The Saving 1 Million Lives program in Nigeria. We're working with Elizabeth Glazer Pediatric AIDS Foundation in Tanzania with mothers to mothers in many different countries. So in a world where there still is such discrimination, inequality and, to say it, patriarchy throughout the world, can we use the fact that the majority of women, even the majority of young women, have access to a cell phone? Can that be a tool to overcome isolation, to provide access to health services, particularly sexual and reproductive health and rights, and to provide information that empowers people in their lives to make choices for themselves? The particular project I'd like to focus on, if I may, is based here in South Africa, where we are. The Mum Connect program was announced earlier today as a major initiative of the South African Department of Health to improve maternal health throughout the country. There were over 40 small projects in this area. The Department of Health last year pulled them all together and produced a national program, getting commitment from many different players, the operators, researchers, health organizations, clinical organizations, to, as part of the re-engineering of primary healthcare, providing messaging to over, the target is 500,000 women by the end of the year, in all 11 official languages. Also at the facilities allowing the health workers to collect the data and get useful information to improve the care, and producing all the back-end systems for a national pregnancy registry, the first time that's ever been in the country. So this is a public-private partnership bringing together many dozens of different organizations to be the largest mHealth program, to my knowledge, certainly in South Africa, I think in sub-Saharan Africa, focused around maternal and child health. So if I may, just in closing, thank you for the opportunity. What I'd like to say to the people in this room and those on the internet and other ways accessing us, if you would like to learn more about how to use mobile to support maternal and child and other forms of healthcare, please get in touch with us. That's our job. That's mHealth's job, to work with people who want to do this work. And if you have some experience and skills, please join us on the other side. You're part of the answer as well. We'd like to get a peer network of people to support this work globally. Thank you very much, Nargis.
Thank you very much, Peter, and thank you very much, Pauline.